Well, March is Colorectal Cancer Awareness Month in the U.S. Over 140,000 people are diagnosed with this type of cancer each and every year. So our medical expert, Dr. Kevin Campbell, he joins us this morning to tell us more. Great to see you.
Good to see you.
Okay, so unlike breast cancer, lung cancer, heart disease, we don't often hear a lot about colon cancer. So explain, what is colon cancer?
So colon cancer is a cancerous growth of the lining of the large intestine.
Okay.
It is something that occurs over time. It's something that may not always have symptoms with it. And so it's so important to know what your risk factors are and to screen aggressively for it. Do you realize that colon cancer is the second leading cause of cancer-related death in the U.S.?
That's amazing. But you know, the survival rates are pretty good if you catch it sooner than later. But let's talk about those risk factors. What are they?
So one of the things that we know, there's multiple, is obesity can be a risk factor. A diet that's high in fat or in red meat. Alcohol use, tobacco, all of these things are very important. Some of the things that help prevent are a diet that's high in fiber and exercise, so things that are good for you anyway.
Very good. And for people at home who want to know, you know, do I have this? Maybe they have some symptoms. How are they screened for colon cancer?
One of the most important things to screen for colon cancer, particularly after age 50, because age is a major risk factor for colon cancer, is screening colonoscopies, where they take a light and they look inside your colon and they look for polyps, which are abnormal growths. We spoke with Dr. Deborah Fisher, a gastroenterologist at Duke this week, and she has some tips for us on screening for colon cancer.
Let's take a listen.
If it's caught in an early stage, 90% 5-year survival. If it's caught at a late stage where it's spread throughout the body, only 9%. And that number hasn't budged much in decades.
That's pretty amazing. Just like you said, it's so important to know your risk factors and to get screened, especially if you're over the age of 50 or you have a family history. Now, there's a really good event that people can get involved with in terms of colon cancer and research. Tell us more.
So this Saturday at Broughton High School at 7:30 in the morning, there's going to be a walk to support colon cancer research. It's called Get Your Rear in Gear, and it is a wonderful way to raise awareness for colon cancer. Lots of local hospitals will be there. There'll be information booths. Go. Friday is Wear Blue Day, like we're wearing today, because we want to raise awareness for colon cancer screening.
That is fantastic. Great awareness. And also, you mentioned obesity as one of the risk factors, so why not get in shape and exercise?
Exactly. There'll be a 5K run and some walk.
Okay, sounds like it's going to be a lot of fun. Dr. Campbell, thank you so much. And if you have a question, a medical question for Dr. Campbell, it's easy to ask him those questions. Log on to our website at WNCN.com and look at the links that we mentioned, and you'll find it all there. Dr. Campbell, always great to have you.